Hello guys, today we'll cover a few brief points for diabetes. Okay, so let's start with the definition. So what is diabetes? Essentially, diabetes is a condition that causes high blood sugar due to problems with a hormone called insulin, which regulates blood sugar. Okay, so there are high concentrations of glucose in the blood. So this happens when the body is unable to process blood glucose for two reasons. The first reason would be the pancreas does not produce enough insulin, and the second, the body cannot effectively use the insulin it produces. So diabetes can be split into two main types. Type 1 is an autoimmune disease where the body attacks the cells that produce insulin. Those cells are located in the pancreas. And type 2 occurs when the body does not produce enough insulin or does not use it effectively. It's also the most common type. As a little fact, it's also possible to develop gestational diabetes during pregnancy. This occurs when there is not enough insulin produced in the body to meet the extra demands for the increased blood sugar levels to do with pregnancy. This can definitely be a little scary and also surprising. However, if the condition is detected early and is well managed, it is possible to reduce the risk of developing any serious problems during and after birth. Also, this condition usually disappears after giving birth. Now, let's talk a little bit about type 1 diabetes. Type 1 can be treated with daily injections of insulin to regulate blood glucose levels. Initially, you could be asked to have meals and inject a fixed dose of insulin at specific times every day. As a little fact, did you know that your body can be producing insulin for up to a year after you've received your diagnosis, known as a honeymoon period? Once it ends, you might require some readjustments in how to manage your blood glucose levels. If that is the case, please speak to your doctor or diabetes team. Now, let's have a look. How can you monitor glucose levels? You can share blood glucose data with diabetic team, use insulin pumps, use continuous glucose monitoring, or use flash monitoring. Blood glucose levels can be split into two main categories. The first one is hypoglycemia, which indicates that levels are too low, and the second one is hyperglycemia, which indicates that levels are too high. The most common signs of hypoglycemia include feeling hungry, sweating, feeling agitated or anxious, blurred sight, trembling, and feeling shaky. To treat these symptoms, try to eat or drink something sugary, but try to avoid any added fat such as chocolate or cake, as it will slow down the recovery. Blood glucose levels will then need to be checked again after 10 minutes. In some emergency cases, it is also useful to inject glucagon, as it will help to release stored glucose from liver and should promote their recovery within 10 minutes. It is useful to store some glucagon at home or with trained friends and family members. Now let's have a look at the most common signs of hyperglycemia. These include feeling extremely thirsty, peeing more than normal, losing weight without trying, feeling tired more often than usual, having fruity smelling breath, and having blurred vision. Hyperglycemia can happen if you're stressed or unwell, if you became less active, or haven't had enough insulin for your recent meal, especially if it contained carbohydrates. Hypoglycemia can be extremely dangerous, and if blood sugar levels get too high, this can lead to a life-threatening stage called diabetic ketoacidosis. At this stage, your body starts to break down fat for energy when there is not enough insulin, which leads to a buildup of ketones, acid, in the blood. They might be present if blood glucose levels exceeds 14 mol. This stage can develop very quickly, sometimes over just a few hours, and in rare cases can also develop in diabetes type 2. Infections and excessive alcohol consumption act as common triggers. Now, let's have a look at the common symptoms for DKA. These include stomach pain, feeling sick or thrown up, ketones in your blood or pee, feeling dehydrated, rapid and deep breathing, feeling extremely tired or sleepy. Unfortunately, over time, diabetes can lead to other health problems, such as foot and general circulation problems, heart disease or stroke, sight problems or blindness, pain and loss of feeling, nerve damage, kidney problems. Therefore, it's extremely important to not miss any important appointments and keep diabetes under control as much as possible to protect yourself from these health implications. Now, let's have a look at diabetes type 2. It's possible to not even realize you have this type of diabetes, as the symptoms can be very subtle. It's often associated with genetic predisposition or being overweight or inactive. Most common symptoms of diabetes 2 are feeling thirsty all the time, peeing more than usual, especially at night, feeling very tired, losing weight without trying to, itching around genital areas, getting thrush frequently, cuts or wounds taking longer to heal, and blurred vision. If you're experiencing any of those symptoms, you should book an appointment with your GP. Your doctor will assess your diet and exercise routine and discuss possible necessary readjustments. You could also be offered medicine that will help you to lower your blood sugar. And now let's get into the quiz for more in-depth clinical assessments. You'll have 5 seconds to answer the question. What is a presentation of diabetic ketoacidosis? And their answer is nausea or vomiting, abdominal pain, diabetic symptoms, dehydration, decreased consciousness, rapid and deep breathing, co-small breathing, and fruity or acetone breath. The second question is, name a few conditions that could be ruled out prior diagnosis of DKA. And the answer is sepsis, lactic acidosis, alcoholic ketoacidosis, starvation, acute pancreatitis, salicylate poisoning, hyperosmolar hypoglycemic state, uremic acidosis. Next question is, what clinical investigations are appropriate when considering a DKA diagnosis? And the answer is ECG, urine dip, venous blood gas, chest x-ray, blood cultures, urea and electrolytes test, lab glucose and ketones, and full blood count. And the last question is, what does the initial management of DKA involve? And the answer is NE approach, airway breathing circulation disability exposure, stop fluid resuscitation, insulin treatments. FRIII stands for fixed rate intravenous insulin infusion, and potassium replacement. I hope you found this video useful and we'll see you soon. Thank you for watching.